Hey guys, welcome back to another episode of Tea Time. I'm Sophie.
And I'm Isa.
And in this episode, we decided to talk to some doctors, nurses, and firefighters and ask them how their experience during COVID-19 has been for them. So when we conducted these interviews, we found out a lot of things that we didn't know about hospitals. And we were able to get an inside look of what it's really like to be in a hospital during this pandemic.
Our first interview is Dr. Rodriguez, who is a cardiac electrophysiologist stationed here in South Florida. How has quarantine and the virus affected your workflow?
So good question. So I'm in cardiology, or specifically, I do electrophysiology, which is a cardiologist that does electrical problems and like devices and all that stuff. So it's impacted it huge, because what happened was, well, in the country, it's really like in late February that it really exploded, in New York first and then Washington and all that. In Miami, really about the second week of March is when things really, really got crazy. There's a lot of learning that had to happen in a very fast pace, like what kind of protective equipment to wear, how contagious was this thing, how prevalent was this thing, how was it transmitted. And so what happened was we did a couple things. We shut down all elective procedures, every single surgery, unless it was an inpatient, meaning a patient that was hospitalized, or it was a medical emergency, like they would die if they didn't get the procedure. Those are the only ones that we were doing in the last they just reopened yesterday. So this week is actually good timing on the interview. Tomorrow is actually my first elective surgery day back in action or whatever. And that was like 2 months. It impacted it in the sense that we were only available for emergencies, but a lot of people, it's kind of scary because a lot of people everyone was scared, but a lot of people that probably really needed to go to the hospital were staying home. And, that's a problem in itself.
Now with the coronavirus, do you feel safe going into work every day?
Yeah, I mean, you have to respect the virus. You take, I guess the limits to, you take the scenario or your behavior to both limits, to both extremes. So on the one hand, you do nothing and don't wear a mask and you don't follow any protocols, and you do business as usual back in January or whatever, and that's probably not a great idea. And then on the other end of the extreme, you enshroud yourself, and don't ever leave the house, leave medicine as a whole and all of that stuff. And that's probably not a great idea either. I do now, in the sense that a lot has changed since the first week of March, but suffice to say, I look like a stormtrooper now, from Star Wars or whatever. Talk like Darth Vader. So they actually nicknamed me Darth or whatever, or Vader, at the hospital because it's called a P95 respirator. So it's this ginormous thing that goes in front of your mouth and your nose and all that. We use face shields, so we kind of look like riot police or whatever, like a mask in front of you. And then I use glasses anyways that are special glasses to cover your eyes and stuff like that for procedures. So we do that. But more importantly is that in the last 2 months, we developed something called rapid antibody testing. So it's kind of like a flu or like a strep throat test or whatever. Like if you were to go to your doctor or urgent care or whatever, they would stick a very long Q-tip equivalent into the back of your nose and you would feel it to get a good sample or whatever. And then they smear it, and within an hour you have yay or nay, positive or negative. And anyone who sets foot in the hospital, we're going to swab you patient-wise. So these are things that improve the safety profile. So yeah, I feel okay. I just have to wear some extra stuff, and unfortunately, they closed down the cafeterias and stuff like that. So that's kind of weird. Yeah, reasonable things. I think things are going to be a little different for the next couple of weeks to months. Anesthesia is also taking their precautions because when we do a surgery, we have an anesthesiologist and a couple other team members, and they're taking their precautions and everything. I think now it is. And the testing is getting even better. Like last week, they announced, so when you look at a test, the buzzwords are how sensitive is a test, meaning how good of a test is it at picking up whatever it is that you're trying to test for. There's a company, La Roche, who developed a 99% sensitivity, which you can't really ask for much better than that in medicine. So as opposed to the first test where like only 80%, which 1 out of every 5 people you may miss. And that's that's not so great. So I think, things will get better. I think we're all ready to roll. And I wasn't used to sleeping that much and having that much free time and stuff like that. So I took up hobbies, but I'm ready to get back in the surgical room, So,
What precautions are you taking to stay safe?
so we see patients obviously for procedures, of course, but we also see them in the clinic. In the clinic, we eliminated our waiting room. So there's no waiting room. The minute you set foot into our building, you have a temperature scanner, and people with any respiratory symptoms or anything are essentially not allowed in. It's kind of pretty authoritarian if you think about it. But all patients are mandated to wear a mask. Once again, we all look like stormtroopers. So all of our staff have full gear, face shields, respirator masks. We kind of wear a picture of ourselves without gear on ourselves so that we don't like scare the heck out of people or whatever. But yeah, so we took those precautions, and then in the surgical rooms, all of our operating rooms are now at negative pressure, meaning it's just ventilation precautions in case you have aerosols, meaning like the virus likes to surf on little droplets of fluid that are suspended in air. So we have, negative pressure, suction, and all that to remove that. We use UV light to disinfect between, cases. So it looks like a little, I guess it's a Star Wars theme, but like a little R2D2. You roll him in there, and then he lights up the entire OR with UV light, with no one in it, of course, to kill stuff. Swab everything down, every surface with a lot of disinfectants. Again, I do all my procedures now with full gear, so I assume everyone's positive, even if they have 3 negative tests. I don't care. I just take full precautions anyways. But you're not allowed to have a procedure if you have a positive test. That's not emergent, rather.
So you said when you're going into the hospital and you're wearing all this gear, you have a picture of yourself on you without the gear?
Yeah. So the nurses started it first, and we thought it was a pretty good idea. So we'll put like our little headshot or whatever, for RD and stuff like that, to kind of show people that we're actually human and not like these weird clones or whatever walking around. They started in New York. I can't take credit for that idea.
That's super cool though. That's
Patients,
Yeah, clever.
your patient would feel more comfortable like seeing
Yeah, no,
their
it's
face. I guess.
pretty intimidating. Yeah, no, you really look like a riot police. It's unless you give the patient a heads up. But now the patients are actually comforted with all this gear, so it's kind of yeah. I mean, we opened up our clinic last week actually because like we're doing right now, we moved over to telemedicine. So we're seeing patients, virtually through your laptop or through whatever, your iPhone or for the Droid users, whatever they have. But that's actually another thing we did is that in March, we shifted almost entirely to virtual care. There are some limitations in that you can't examine someone, that easy. But we have like little kits where you could put your fingers on something and we can do an EKG, and I can check and reprogram your pacemakers and defibrillators remotely and stuff. So there's a lot that you can do, and it's better than not seeing a doctor, but there was still some limitations.
Do you feel that with the virus now abroad, do you feel that it's affected your work more than you thought it would at first?
Yeah. Oh, yeah, sure. Everything exploded since December 23rd, I think, in Wuhan or whatever. And, by definition, that's a pandemic, These things don't like announce themselves. With globalization and how interconnected we are as societies, that is great for learning and cultural dissemination and stuff like that, but not so great for viruses because they can hop on a plane and be in New York the next day. The problem with this, with the virus is how long people are asymptomatic for, if they ever develop symptoms, but they're able to spread it, so that was the game changer. Fortunately, it doesn't look like it was as deadly as initially thought, because the initial numbers, made anyone want to run to the hills or lock themselves up forever. The numbers itself, but again, its ability to disseminate.
Do you feel like you've developed a better relationship with your coworkers because of this?
Yeah, I think especially, when you saw the images out of New York was a special case just because they had a lot of variables that were not in their favor. Luckily in Miami, the heat and the UV really helped out, and the fact that we don't have any public transportation. You can't really count the metro rail, and the bus system's pretty bad. So usually. So these things, while normally they would be horrible, were actually great defensive mechanisms, because in New York, you only have so many subway rails, train number 1 through 7 and A through L and all of that. But problem is that it facilitates its dissemination, of virus, because, this thing could live in colder climates for a couple days even. And in Miami and in Florida, for that matter, we have a lot of sunlight and a lot of different things, that helped out a lot.
What kept your drive to go to work? Like, was there a point where you didn't want to go to work because you didn't feel safe? And if so, what kept you going?
Yeah, I mean, I think initially, like in March, when there were reports coming from Italy and New York of how this thing was so transmissible, and the World Health Organization and the CDC, I mean, they were so confused. They didn't know heads from tails. They were not supremely helpful at all. First, they're like, "Oh, it's not a big deal." Then it's like, "Just kidding, it's actually a really big deal." And then at first it's like no mask, and then it's like, okay, a surgical mask, and then it was like, oh my god, actually N95, and now a scarf or something. So they were all over the place. And I think with a lack of information at first, yeah, sure. I mean, I myself, I'm 36 and I have no medical conditions, thank God, and I take care of myself. It's not myself or my wife. It was our parents that we were worried about, or grandparents and all of that. So yeah, there are some periods where you're a little worried. Luckily, from the get-go, I have a lot of friends in New England because I did my training in Boston and stuff, so I got to compare notes to what they were doing up there that was working or not working. Believe it or not, eBay is awesome, because Amazon sold out of everything, and all the local stores here like Home Depot and Lowe's and stuff like that, they ran out. And the hospitals were, it took a while for the supply chains to catch up because everything is made in China. Like 95% of protective equipment was made in China, which in hindsight is not a fantastic idea. But on eBay, actually, I just bought, the respirators and stuff from day one. So I look like a stormtrooper back in March, and I still look like a stormtrooper, and I'll look like that until December, until I get a vaccination.
Next, we interviewed Ariel, a firefighter and a paramedic.
How has quarantine and the virus affected your workflow?
It has affected everybody, obviously, all over the world, and affects us directly because we have to respond to homes, no matter what the situation is. Going into the home, we don't know if they're going to have COVID or not, if they're going to be positive or not. And we still have to do our job, regardless, whether it's a known COVID patient or if it's not a known COVID patient. We have to treat them all the same, and we have to still continue to do our job. A lot of us on the job have gotten the COVID virus. Not a big percentage, but a small percentage. And it has put a lot of us out of work for 14 days that you have to quarantine.
Now that the coronavirus is here, do you feel less safe in your job than you did before?
The only uncertainty, I think, across the board is that you could have it and be asymptomatic. We've always been very professional and very cautious of using personal protective equipment on every call. No matter what the call is, we've always been very professional about that and very consistent. But yeah, having patients that could possibly have it and not show any symptoms is a variable that we're not used to. But again, like I said before, we treat everybody as if they could be contagious, and we take care of ourselves. So not much has changed in that aspect. It's just since it's highly contagious, we have to be extra careful with our respiratory. Because we would not normally, under normal circumstances, we would not wear a mask going into calls, and it could be a respiratory. It could be airborne and going through our respiratory system.
What exactly are you wearing to stay safe?
Well, like I said before, we normally would just wear gloves and possibly goggles before COVID. Now, during COVID, we're taking extra precautions. We're wearing gloves. We're wearing plastic sleeves that are all disposable, goggles, and especially masks. 85 masks that we have that try to avoid the COVID.
When the pandemic was first introduced, did you think it would last as long as it has, or have the big effects that it did?
I honestly didn't. I didn't think it was going to get to the magnitude that it has gotten to, that it has reached. We knew we had to take it serious, but I really didn't know it was going to be to this magnitude, and we still don't know till when we're going to have to deal with it. it seems like we're going to be dealing with it for a very long time due to the lack of vaccines, due to lack of information and facts on this virus. We're still learning every day. So no, I didn't think it was going to be to this magnitude, but it's gotten pretty serious. It's affected a lot of people.
How do you feel about going into work knowing that your life is at risk?
Well, it's always been part of our careers, not just COVID related, but any call, if not taken serious or if not gone about it professionally, endanger your life and the lives of others. We still go to work with the same mentality, do what we have to do. We're out to serve the public. We do the best that we can, while at the same time trying to keep ourselves protected and safe.
Now going into your work, do you feel like there's a higher level of stress that comes with going in?
Yes, absolutely. There is a higher level of stress. Again, for example, if in the past, we would go to a cardiac arrest, which was a call that we would do, unfortunately, we do often. But now it's added stress because now if you are trying to resuscitate a patient, it's in the back of your mind the whole time. You got to get up close and personal with these patients. The possibility of them being positive for COVID. So it's yes, it is added stress on every call now. Some calls we would go to routinely, it'd be kind of like second nature. Now there is added stress.
What drives you to keep working during this pandemic?
This is what we all signed up to do. We love helping the public. It's in our nature. It's in our job. People still need our help, not just us, but law enforcement officers. We need to be out there, doctors, nurses, and we're the front line. And we got to be out there. And we love doing what we do. Is it an added variable? It is. Like you said before, it's the added stress. But we still enjoy our job. And whether there's COVID or not, we're going to go out there and we're going to do it.
Do you think that throughout this virus, you've developed a better relationship with your coworkers?
Not really. Our camaraderie and our work environment is a very tight one. We all get along very well. We all have a very strong team aspect to what we do. That hasn't really changed much. We have always taken care of each other, and we have a strong brotherhood and sisterhood.
During this pandemic, what is your first thought when you go into work?
Well, our mentality every time we go into work is, yes, we want to do our job right. We want to protect the public, but we also got to protect ourselves. We got to get home to our families. And at least for me, every time I leave my home every morning to go to work, I kiss my kids goodbye every morning, even while they're still sleeping, because I wake up super early. My goal is to do my job correctly, but I also got to get home safe to my family. It applies even more so now with the whole COVID thing, because you don't want to bring that back home. You know, chances are that if I were to get COVID, I'd be okay. I would recover. I think I would recover. But you don't want the added stress of bringing out possibly home to your kids and your family members.
How long do you think it'll take before everything goes back to normal, or if it will go back to normal?
I don't see it going back to normal anytime soon. I don't want to downplay it. I know it's a very contagious, very unknown, strong virus, I guess. It's funny because I don't see it going back to normal anytime soon. Yes, we have to wear these masks. I'm not sure. No, I don't see it going back to normal anytime soon. I guess maybe when the vaccine comes around, maybe things will change a little bit.
Do you see things going back to normal like the way they used to, or do you think it'll be an event like 9/11 that'll impact how we do things daily?
Well, 9/11 did impact us significantly, obviously, the whole country. I think we bounced back from 9/11 and we got stronger as a nation. We kind of went back almost to normal, I guess, after 9/11. With this, it's the unknown of, does this person have it? Does that person have it? And I think putting on these masks and this social distancing has made it very awkward. It's made it very stressful to get over it. That's why I don't see it going back to normal anytime soon. I don't want to get too political, but I think the media has kind of put this fear in our minds of, stay away from each other. And now we, 6 feet away from each other plus a mask. And why can't we just go into a store without a mask? Especially if I know I don't have anything, because they're saying to wear your mask because you don't want to give whatever you got to somebody else. And it's a very complicated answer. I don't want to get too into it, but
So you think the recovery from COVID is going to be harder than the one from 9/11?
Yeah, absolutely. We don't know how long this is going to go on. And God forbid something else happens where another flu or another type of virus comes around. And look at other countries like China and Japan. They're wearing masks all the time. They've been wearing masks before COVID. I don't see us taking these masks off anytime soon, unfortunately. I'm not a big fan of them.
So you said you think the media is over-exaggerating this. And do you think that the way the media is portraying this virus is wrong?
No, I don't think it's wrong. I think we do need a heightened sense of security. I do think we need to be very cautious of the situation. I can't speak for the media. It's just in my opinion. I think fearing just walking next to each other and this social distancing, and it's gonna have a lot more effect than we think. It's not gonna go away anytime soon. It's affecting our day-to-day lives. You know, this whole quote unquote new normal everybody's talking about, it's affecting everybody's lives, not to mention all the people that their businesses have to shut down because of it. That's a whole other aspect of this whole thing, that the United States economy has taken a major hit.
Have the amount of calls increased more because of
No, they
this?
have decreased. The amount of calls have decreased, believe it or not. Not sure why. I think people are more afraid of going to the hospital now. Nobody wants to go to the hospital where they could possibly get the COVID virus at a hospital. So I guess people are holding back from calling 911. I mean, the calls are still coming in, obviously, but a little bit less. But I guess once everything goes back to normal, it'll get back to normal. The call volume will get back to normal.
Our final interview was Emily, who is an RN, also known as a registered nurse. How has quarantine and the virus affected your workflow?
So actually, I graduated in December of 2019, and then I had to take my boards, which are like your exam to become a registered nurse, like approved through the state and stuff. And then I was supposed to start my residency program in March. And since I work at Baptist, whenever you're a new nurse, like you just graduated from school, you have to go through a residency program, which is a certain amount of weeks depending on what department you're hired for. And you take different classes, you do simulations, like different things like that, in order to get you ready to be on your own and take care of patients. And they basically had to suspend my residency when I started in March because we couldn't do classes in enclosed spaces and have so many people. They tried to do them through Zoom, but it just got really complicated with everything going on. So since my start date was March 16th, and since then it's maybe a week or two after that, it got suspended, and it's still suspended now. So basically, I'm still being trained, but there's everything that I needed to get online, and classes and simulations and stuff has still been suspended. I really haven't, I've been being trained, but not through the program as it was planned. So it's kind of on hold, and hopefully they'll be able to start it in a week or two. But we're still not 100% sure.
So when you started in the nursing field, did you think that this is how your first job experience would go?
Not at all. At all. I thought, being a new nurse, they always say you're gonna have a lot of it's a lot of changes. It's very nerve-wracking for a while. You feel a little lost until you kind of get the hang of things. Nobody can prepare you to start working in a hospital through a pandemic that nobody really knows. Everybody takes it day by day. I kind of go into work every day I can't get comfortable knowing what's going to happen. It's always something new. So I definitely had no idea this was gonna go this way at all. I was really excited to start and everything, and it's been okay. It's really hard sometimes, but it's been getting better, so that's a good thing. But no, I could have never guessed this was how I was going to start working.
What precautions are you taking in order to stay safe?
So I actually moved out of my house for about a month and a half almost. I was staying, my boyfriend is a nurse as well, so I stayed at his house because his parents and his grandmother moved to their house in the Keys so that they would be away from him because he works as well in the emergency department. So we were both exposed. And then my grandma lives with me at my house, and I work in the ICU, which is the intensive care unit at Baptist. So I was around COVID patients as well. So I had to move to his house for about a month and a half so I could be like away from my family and just like kind of quarantine, but like with people that are in the hospital too, so that my family wouldn't get sick and his either. And I actually was just able to move back to my house on Monday. So
That's good.
that's good. But I did have to, I had to move out for a little bit.
When you're going into work, what is the first thing you think walking in there? And do you feel safe?
In the beginning, it's more I mean, once you're kind of in the COVID unit, in the beginning, it was really nerve-wracking because like I didn't know what to expect. It was like a very gloomy environment. Like everyone's very tense just because they like didn't know if new things were coming out every day on like how it spreads and things like that. So it's like you were taking every precaution like to keep yourself safe. So the first time I normally go in my scrubs. I had to change out of my scrubs, go into different scrubs, wear double masks, like wear an N95, and wearing that for like 12, almost 13 hours, it's very uncomfortable. And then with this another mask on top, just for like double protection, you get very like more conscious of always washing your hands and just like things that before you wouldn't think of, like, oh, I touched this, but like it's really not that dirty, but then you're like, okay, maybe it is. So you're constantly like just very self-aware all the time. So it was kind of like physically exhausting, and then like mentally, because you're like always worried, at least in the beginning, and then you kind of get the hang of how to keep yourself safe and stuff. So it took time to adjust to that.
Are you feeling higher levels of stress because of the new circumstances?
In the beginning, for sure, especially being a new nurse, that I don't know, I'm not like properly trained yet. So I was just really trying to like help everybody as much as I can, and whatever role they gave us, like just be as helpful as I could. But it definitely was stressful just because you don't know what your day was going to be like if you were going to be in the COVID unit or if you weren't. So there was times that I was there for like 2 weeks, 3 weeks straight, and then one week I would be put in the non-COVID unit, and then like the next week I would. So it was just mentally like you had to come in not knowing what kind of day I was gonna have. So it has stressed, and also because it adds stress, and also because my residency has been suspended. But it definitely has gotten like a little better in the past like 2 weeks.
When you first heard about the pandemic and it was first starting out, did you think it would affect life, not only work, but life as much as it has?
I don't think I never watched the news really. I don't think I paid attention much to it, but then obviously since it affects my workplace, it's like it made me pay attention a whole lot more. So it has affected my work life and my home life because I had to move out of my house. It's definitely it's a day by day situation, but it definitely has like changed all aspects. It changed all aspects of my life, my work life, and then my home life. So I definitely felt a big change, and I didn't really know it was going to get this big. And it gets kind of hard to realize like, okay, like when do we see a little bit of change? It's nice in the hospital because I can see patients getting better and being discharged, but life itself is not really normal yet. I don't really know when it will get there.
Have you ever been hesitant to go into work? Like, oh, what if something happens? And if so, what keeps you, like, what's your drive to keep going to work?
Well, I guess I don't really look at it like I have an option. Like it's a career I chose, and nobody could have ever written this. At least I think like I would have never guessed this. I would have guessed like 12 hurricanes in the same season before I guessed this, because that's something that has impacted my job also before. So this is something completely different. I guess I just I don't really look at it like an option. Like I gotta just have to go to work. And there was a time that it was very like a 1 week that I was just like overwhelmed, especially since I'm new and you want to be helpful, but you don't have all the tools yet to be helpful in that sense. So it was overwhelming. And then not being home and being around my family was also stressful. So there was a lot of times where I felt like overwhelmed. But when you start seeing things change and things getting a little better day by day, it does make it better. And I guess I just kind of have the mindset when I go into work, literally when I park, I'm like, okay, whatever day you're gonna have, like it's gonna end. It will end. Like I will get to clock out. So I just look like, not that I look forward to that, but it's like everybody's going through something right now. It's not just me. So you just have to take it day by day. Like every day is going to be different. So just go in and like do the best I can to keep myself safe, be aware, wash my hands, don't touch unnecessary things like that I can do on my own that make me feel like I'm doing something for myself and that I'm keeping myself safe.
When you go into work, it could be 2 weeks that you're in the ICU, or 1 week you're in like a different department, if that's how I interpreted it. I don't know if that's correct though.
There was a new building being built for an ICU department, and what they did was they transferred like all the patients that were non-COVID in the old ICU, they transferred them to the new ICU. And then the old ICU building was strictly a COVID ICU. So if a patient came in and they were COVID positive and they needed ICU care, they would go there. And that way they were able to separate like non-COVID ICU patients and COVID ICU patients. So there was a time for like 2 or 3 weeks where I was in the COVID unit with dealing with like helping with those patients. And then already like the last 2 weeks going on 3, I've been in the non-COVID ICU. So since our residency was suspended or postponed, better said, they put us as runners, which is basically in the ICU, like there's different pods. And then each room is like, it's its own private room. So each patient had their own room. And basically we would stand outside of the room and hand the nurses that would go in whatever they needed, supplies, if they needed help with anything, like to hand them to them, we would do that. And then once they would step out of the room, we basically would hand them wipes, clean them down, like help them take everything off just to like contaminate as least as possible. And that like allow the nurses help, like if they were in the room, like if they forgot something, then we could go and get it for them so they wouldn't have to come out and like waste PPE to then go back in, and also expose other people that like just because they needed to come out to go back in. So we were basically runners is what they called us. Like we're new grads, so since we started the residency, we're new nurses. So there's like 5 of us, and they would schedule us on those days and assign us different units that we would be, but we would still be runners. So we were in the COVID unit helping in that sense.
Based on those interviews, it was an interesting look on the perspectives of a first responder and how their daily lives are during this pandemic.
Thank you guys for listening. This has been another episode of Tea Time with Sophie
And Issa,
signing off.
see you next time.